Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello everyone. India's daily COVID numbers have come down, but with the arrival of Omicron, fears of a third wave have returned. We are, in fact, back to asking the same question that we were asking around the same time last year. Will the next year be any different? To discuss what the new variant means for India, whether boosters are indeed the way forward, and the big question of when will the pandemic finally end, we have with us today Dr. Brian Wahl, Assistant Scientist, Department of International Health at the Johns Hopkins Bloomberg School of Public Health. Welcome, Dr. Wahl. Hi.
Hi, thank you for having me.
So we'll start off right away. What is your initial assessment of Omicron?
So the Omicron variant, which emerged in Southern Africa a little over a week ago now, is of concern for epidemiologists, for virologists, for public health practitioners for a number of reasons. One, there are a number of mutations to the spike protein, which we, in this number and in this constellation, we have not seen previously. And these mutations give rise to fear of both immune escape as well as higher levels of transmissibility. And so we're keeping a close eye on the developments in South Africa in particular. We've seen a rise in cases in at least one province in South Africa. We've also seen the Omicron variant show up in several other countries, almost 30 countries around the world, maybe even more by the time this goes to air. And so this is concerning for a number of reasons. We still need to learn a lot more about the Omicron variant. We still need to learn the extent to which these mutations allow it to evade the immune system. We need to learn more about the exact or a better understanding of the higher level of transmissibility. And then a key question that still remains is the severity of disease associated with the Omicron variant, both in vaccinated as well as in unvaccinated individuals. The promising news from South Africa is that initial reports, and I have to stress that these are initial reports, and we'll learn more in weeks and months to come, but the initial reports are that many of the cases are mild cases. And so that's promising, but that doesn't mean that we need to take this lightly. We need to take this seriously and be prepared and be vigilant.
When you say mild, because we have seen our second wave was almost all of it was Delta. So when you say mild, can you give a sort of comparison? Is this milder than Delta? Is it possible to make such a statement?
It's hard to compare at this point with the Delta wave. One of the reasons that the Delta wave, both in India and in other countries as well, one of the reasons it was so devastating was that the steep rise in cases also caused concern in many places around the world, overwhelmed health systems, and that was a large part of what drove the second wave in India and the Delta waves in other countries as well. We are not where we are. We are not currently where we were at the beginning of 2021, even before the second wave. So whether we experience a second wave, a third wave that's on par with the second wave, I think is unlikely. I think many other people also believe that it's unlikely. We know a lot more now than we did then about how to prevent transmission. We now have much greater immunity, both from infection-induced immunity as well as from vaccine-induced immunity.
Right. So when you say unlikely, I'm supposing you are taking into account the high levels of seroprevalence in India that successive sero-surveys have shown. But even with that, don't you think that unlikely comes with the proviso that we continue to do whatever we were doing as stringently as we were doing, masking, social distancing, and all of that, right?
Absolutely. We need to, as I mentioned earlier, we need to remain as vigilant. We need to take the interventions that we know work, social distancing, wearing face masks, improved ventilation, vaccination, and we need to really double down on these measures, and we need to implement them more rigorously. What we can do as well at the borders, and one of the things I've been very encouraged by is that India has not pursued any of the broad travel bans that other countries like the US have implemented. I think that's very reasonable. That's a sound public health approach. But what has also been encouraging is that those measures have also been paired with effective measures at the border. So looking at quarantining of individuals coming from high-risk countries, improved screening at the borders as well, encouraging the use of face masks among individuals who are arriving from abroad. These are all measures that we know can help continue to slow the spread of disease, and I imagine will be effective in the weeks to come.
Right. So, we've been talking of late, especially after this Omicron, a lot about booster doses. Now, currently, about 50% adult Indians are fully vaccinated. About 15% adult Indians are yet to get their first dose. And we have not started children's vaccinations at all. Now, that being the case, is it fair to talk about boosters, or if it is an either-or situation, should we first complete vaccinations of adults and then start boosters, or should we sort of do it simultaneously?
So we have to remember what the purpose of an immunization program is. And it's, in this case, it is to reduce the likelihood of severe disease and death. And so what I would prioritize, and what India has been prioritizing, is getting individuals that 15% that you mentioned who have not yet been immunized, getting those individuals immunized, getting the individuals who have only had one dose, making sure that the full completion of the 2-dose primary series is completed. Those are my, I think, highest priorities. Those targeting those individuals and groups will help to maximally reduce risk of disease and death. Once there are sufficient doses to once sufficient progress has been made in getting those groups immunized, the next the other considerations that need to be made in an immunization program as well are who is at greatest risk. And so immunocompromised individuals who have not yet had a strong enough immune response to the vaccine, those individuals would likely be the next that you would want to prioritize for an additional dose. Booster doses very well will very likely need to be prioritized in the weeks and months to come. It's, again, the priority for me is to make sure those unimmunized individuals and those individuals who have only received one dose receive doses. We also have to remember that we are, this is a pandemic, and a pandemic is global. And we need to remember that there are other countries as well who have yet to receive enough doses to immunize even those at highest risk. I'm thinking of many countries in sub-Saharan Africa in particular. And so, we all countries, especially countries with vaccine manufacturing capacity, need to be thinking about how to ensure that individuals around the world, especially those who are at highest risk, have access to vaccines as well. Children, we know, are at very low risk of severe disease and death. That doesn't mean that there haven't been cases of children who have had severe COVID, but in terms of reducing risk, the best approach at this point, I think, is still to prioritize those high-risk groups: older individuals, those with comorbidities, immunocompromised individuals.
Mm-hmm. Actually, that was my next question about vaccinating children, because you started off talking about the health system being overwhelmed, and already in several parts of India, as schools are reopening, hostels are starting to function, we are seeing a lot of clusters of infections in children. And the last time our experience has been that it takes a very short period for these things to sort of go from a small cluster to like something that completely overwhelms the health system. So with that in mind, and we currently have a licensed vaccine for 12 to 18-year-olds, not lower than that, but for 12 to 18, we have a vaccine. That being the case, and since you mentioned sufficient doses of vaccines, we have right now about 220 billion vaccine doses that are lying with the states unused. Do you think it's time we should also start on vaccinating children?
So, as I mentioned, the priority is still those higher risk individuals. One of the learnings from the seroprevalence studies is that children have maybe a little bit less, but have largely been exposed to the virus at the roughly the same levels as older individuals. And so my interpretation of that is that we haven't seen a huge there haven't been huge numbers of children who have been at high risk of severe outcomes. The other consideration when immunizing children is if immunizing children can help stop transmission to older individuals as well. And so that's a real important consideration to make. However, the direct protection to those older individuals through directly immunizing those individuals, I think, is probably the best way forward. Given that there is a vaccine that's been licensed for children, given that there are sufficient doses of that vaccine available, I would imagine at some point it would make good sense to begin immunizing children. There are several countries around the world who have been immunizing children, including the United States, for example. I want to stress that that's it's important, and children are at lower risk, but not zero risk of disease. And so it actually, there's for me, it boils down to when you can start to make trade-offs between absolute risk, which children are at a low absolute risk of, but when you can then begin to focus on relative risk. And so, even though children are at low risk, if we can begin to at some point reduce that even further, that makes that would be a sound public health policy to pursue. But of course, focusing on where you can first reduce the absolute risk for the overall population as a priority.
Mm-hmm. So some experts have been saying that COVID is now endemic in India. What is your take on that?
It's the technical definition of endemic is if a disease is within a community and not causing spikes in cases. You can have endemic levels here, or you can have endemic levels here or here, and so on and so forth. So first of all, it's a relative term, just meaning that it's circulating without causing epidemic spikes. And so we see cases coming in on a daily basis. It doesn't mean that there isn't epidemic potential. Of course, there could still be epidemic potential. Endemic isn't a fixed classification that can change over time. And so, using the technical definition, yes, COVID seems to be endemic. That doesn't mean that tomorrow we can't be both in an epidemic phase and also endemic might look very different tomorrow than it looks today, for example. So it's to me, it's not a terribly important term. I think the trajectory of where we are at any given point is I think more important. But from a technical perspective, it would seem that yes, it is.
So tell us a little bit about the Tikala Guyana campaign.
So as we've discussed, Omicron is concerning for several reasons. The Omicron variant. However, we know that we have tools in place that are effective. One of the most important tools for curbing severe disease and death associated with this virus is immunization. We have partnered with the Postgraduate Institute of Medical Education and Research in Chandigarh, PGI-MER Chandigarh, as well as partners at Wyden and Kennedy on a campaign to build and to strengthen confidence in COVID-19 vaccines in particular. And we've used the best evidence that we have available on how to engage with individuals around building vaccine confidence. And so we've been partnering with several NGOs, civil society groups. We've partnered with MyGov to really get the message out that vaccines are powerful tools for protecting yourself, protecting your family, protecting your community from COVID. And so the centerpieces of this campaign are three beautiful videos that have been directed by Neeraj Gavan, well-known, well-respected National Film Award-winning director, which are available on tikalaguyana.org. And we're really excited about the campaign. The campaign is powered by individuals who are sharing these videos with their families, with their friends. The videos can be downloaded from the website and shared easily over WhatsApp, for example. So we're really excited about this campaign, and it's important, more important now than ever, to make sure that we're getting vaccinated, that we're getting our second doses, and so we hope that this campaign can support that effort in at least one small way.
So the government of India has been saying that India is one of the less vaccine hesitant nations in the world. A, do you agree with that description? And B, our daily vaccination numbers have not quite touched the September highs since then. October was really poor. November was better than October, but still poor. So do you see a bit of vaccine hesitancy actually creeping in?
So the evidence that we have from multi-country studies that have been published in peer-reviewed journals do indicate that India has, in a global context, among the highest levels of vaccine confidence, which is really encouraging and really fantastic, and also a testament to the work that many partners, government and non-governmental partners, have been putting into the preparation for the rollout of the vaccine. And so, where we are in India relative to other countries in the world, I think is really encouraging. The two caveats that I would state for that: one, vaccine confidence is not a static thing. Vaccine confidence can change over time. And we know that misinformation and disinformation, especially those shared on social media, can work to erode vaccine confidence. And so we do need to be vigilant just as we're being vigilant with the emergence of new variants, we need to also be vigilant with the emergence of misinformation and disinformation through social media. And so this campaign and the campaign and the work of others is really focused on trying to bolster that at high levels of existing confidence. The other caveat to the high levels of confidence that we've been able to observe in India is that as you make as you increase vaccination coverage, making incremental gains in vaccine coverage in the unimmunized population becomes more and more difficult because those individuals are likely to be the individuals who are vaccine hesitant. And so while we have high levels of vaccine confidence in India, which is again a great thing, we need to be working to chip away at that remaining proportion of individuals who, for whatever reason, do have concerns about vaccination. And it's, especially with highly transmissible variants, levels of vaccination coverage that are required in order to have endemic levels here rather than here is really important. So whatever we can do in order to make sure that we have the lowest levels of endemic disease, that would be ideal. And so it is important to continue chipping away at and working on those communities, those groups that are those areas where we see vaccine hesitancy. Working to ensure that those individuals also have the opportunity to benefit from vaccination.
Okay. So what is your take on mandatory vaccination? Some states in India have started that. Kerala has said they will not treat people who are not vaccinated for free. Pondicherry has said that you have to get mandatorily vaccinated. Is that a good way forward?
So in an ideal scenario, we wouldn't want to force people to do anything. We wouldn't want to infringe on anybody's autonomy, so to say. However, given where we are in the pandemic, and I'm speaking on kind of from a global perspective, I am more and more of the mind that targeted mandates, so mandates for certain professions, for example, for certain individuals, mandates for doing certain activities, accessing certain sites, flying, for example. I am more and more in favor of efforts to ensure the highest levels of vaccination through mandates. I think broad mandates, the entire population needs to get vaccinated. I'm not fully there yet. I think that there is a behavioral aspect to targeted mandates, both in terms of profession as well as completing certain activities. And I would hope that those targeted mandates would help to expand vaccination coverage, especially among those who are maybe on the fence still. And so I think we will see many other governments around the world begin to impose vaccine mandates within their communities. The mayor of New York City, for example, today just announced that all private employees need to be vaccinated. So there's a broad mandate that's being pursued in New York City, one of the largest cities in the world. And so mandates, I think, are powerful and can drive up vaccination coverage to levels that we need to see in order to come back to some level of normalcy, and to ensure that we minimize the probability of new worrying variants emerging.
Maybe Omicron will help with that, because if people are scared, they are more likely to come to the booths.
It could be a small silver lining that we have seen enthusiasm for vaccination and in particular second doses. That has changed and waned over time as well. And so if individuals do take a second look, see what's happening with Omicron, and decide to get vaccinated sooner rather than later, that may be a small silver lining to the emergence of this new variant.
So going forward, do you see COVID vaccine becoming an annual affair now?
It's difficult to say. The virus has only been around for just about 2 years now, and so we don't have really good evidence on what immunity looks like after a booster dose, for example. Some vaccines don't require any additional booster. After one booster, it's a lifelong levels of protection. Some vaccines, as you're aware, like the flu vaccine, require an annual shot. This is not the same virus, and there's reason to believe that may not be the case. Some vaccines, like the tetanus vaccine, require boosters on a more extended timeline, every depending on the country, every 10 or so years. We still don't know enough, and it would be difficult to say with the level of evidence that we have just 2 years now into the pandemic what vaccination requirements will look like into the future.
So you say just 2 years, and it's been a very long 2 years. So,
it has been a very long 2 years.
So I'll come to my final question. How much longer can we ever take off these masks? Is the next year going to be any different?
It's also a difficult thing to say. I think what Omicron, I think, has really hit home for me is that we really are not protected until everybody is protected. And so we need to really consider the global aspect of this pandemic and recognize that it is affecting all countries around the world. And the faster that we can get vaccines to places where they currently are not. Again, I'm thinking sub-Saharan Africa and other countries as well, maybe in the region. The sooner I think we'll all be protected. I know that I would love to see a pathway forward for not requiring masks in public places as well. I think we need a pathway, a roadmap toward. We won't, I think, ever reach pre-2020 normalcy, but some level of normalcy I think we need to return to. I think we need to, this virus is going to stick with us. We're not looking at eradication. And so how we deal with that in the future, I think, depends on how well we as a global community are protected. I would love to see things to get more directly at your question. I would love to see things in 2022 look much different than 2020 and 2021 in a good way.
Right. Let's all hope for that. Thank you so much, Dr. Wahl, for sparing the time to talk to us. And thank you, viewers, for watching. Thank you.
Thank you so much. Thank you for having me.